Section 1. The power of the picture chest X-rays and heart health. Chest X-rays are like a window into your heart and lungs. They help doctors see inside your body without any surgery. For patients with heart failure, chest X-rays are super important. They can show if your heart is working too hard, or if there is fluid buildup in your lungs. Heart failure is a serious condition where the heart can't pump blood as well as it should. This can cause fluid to back up in the lungs, making it hard to breathe. Chest X-rays help doctors diagnose and monitor heart failure, ensuring patients receive the right treatment. Section 2. Spotting trouble key signs of heart failure on X-ray. So what are doctors looking for on these X-rays? They look for specific signs that tell them how your heart is doing. These signs can help them understand if your heart is struggling to pump blood effectively. One sign is something called pulmonary edema. Pulmonary edema is a fancy way of saying there's too much fluid in the lungs. This makes the lungs look cloudy on an X-ray. When the heart isn't pumping well, fluid can back up into the lungs, causing this condition. Another sign is an enlarged heart, also known as cardiomegaly. If the heart has to work too hard, it can get bigger, just like your muscles can get bigger when you exercise a lot. This enlargement is a sign that the heart is under stress and trying to compensate for its reduced efficiency. Lastly, doctors look for pleural effusions. This is when fluid builds up around the lungs, making it hard to breathe deeply. This fluid buildup can be a result of the heart's inability to manage blood flow properly, leading to fluid leaking into the pleural space. Section 3. ABC-DEF, your guide to X-ray detective work. In this section, we will delve into the essential aspects of interpreting chest X-rays, particularly focusing on the signs of heart failure. Doctors use a handy mnemonic, a memory trick, to remember these signs of heart failure on a chest X-ray. This mnemonic helps streamline the diagnostic process, ensuring that no critical detail is overlooked. It's called ABC-DEF, and it's easy to remember. Each letter stands for a specific finding that can be observed on the X-ray, making it a valuable tool in medical practice. A for alveolar edema, which is fluid in the air sacs of the lungs. This can be a sign of acute heart failure and needs immediate attention. B for big heart, also known as cardiomegaly. An enlarged heart can indicate chronic heart conditions that require ongoing management. C for cephalization of pulmonary veins, a sign of fluid overload. This suggests that the heart is struggling to pump blood efficiently. D for distension of pulmonary arteries, indicating high pressure in the lungs. This can be a result of pulmonary hypertension or other serious conditions. E for effusions, which is fluid around the lungs. Pleural effusions can cause breathing difficulties and need to be addressed promptly. And F for fluid in the fissures, the spaces between lung lobes. This is another indicator of fluid overload and heart failure. Each letter in ABC-DEF represents a different finding on the X-ray, helping doctors quickly identify potential issues related to heart failure. By using this mnemonic, medical professionals can ensure a thorough and systematic approach to diagnosing and managing heart failure. Section 4. Putting it all together, a clearer picture of heart failure. Let's break down the mnemonic a bit further. ABC-DEF is a handy tool for remembering key features on a chest X-ray that indicate heart failure. Each letter stands for a specific finding that can help in diagnosing the condition. Alveolar edema makes the lungs look hazy, like a foggy day. This happens when fluid leaks into the air sacs of the lungs, making it difficult for the patient to breathe. Big heart is exactly what it sounds like. The heart appears larger than normal on the X-ray. This enlargement, known as cardiomegaly, can be a sign that the heart is working harder than it should. Cephalization refers to changes in blood vessels near the top of the lungs, indicating fluid buildup. This is often a result of increased pressure in the pulmonary veins. Distension means the arteries in the lungs are wider than usual, suggesting high pressure. This can be a sign of pulmonary hypertension, which often accompanies heart failure. Effusions show up as white areas surrounding the lungs, indicating fluid accumulation. Pleural effusion can cause chest pain and difficulty breathing. Fluid in the fissures appears as white lines between the different sections of the lungs. This fluid buildup can further impair lung function and exacerbate symptoms of heart failure. By remembering ABC-DEF, healthcare professionals can quickly assess chest X-rays for potential signs of heart failure and provide appropriate care for their patients. This systematic approach ensures that no critical detail is overlooked, leading to better patient outcomes. Section 5. X-ray vision, your tool for better heart care. Chest X-rays are powerful tools for diagnosing and managing heart failure. By understanding what to look for, you can become a partner in your own healthcare journey. Remember, if you have any concerns about your heart health, always consult with your doctor. They can help you understand your individual situation and recommend the best course of action.